Hey everyone. Today I want to talk about where the lesion is, and I've started studying neurology in the early '90s with Dr. Carrick at Logan, and I've seen a lot of evolution of the principles of neurologic diagnosis over the years. And as we're learning more, we can go into more depth and extend the range of the things we can treat. Now, TBI is being treated. That wasn't something that was really that accessible to us back then. So there's a lot more that we know, but we still use a model of diagnostics where we're trying to identify the level of a lesion. And well, I think that that's a great way to do things, and it certainly is really, really important. I think one of the things that's happening that we're seeing now with the evolution of perspectives in neurology is that there's more of a understanding of the integrated systems and how information is being put together to be able to control our functions in different ways. So rather than saying it's just a basal ganglionic lesion or it's a cerebellar lesion or it's a thalamic lesion, like we say, there's more of a process that we're understanding of how one thing can affect another. So what we end up with is obviously there's a lot of links in the chain, and the system is very, very complex, and no attempt to simplify that will be worthy. However, some of the principles that we do know, which are very, very useful to consider, are the facts that the older systems probably have a different level of importance versus newer systems. So newer systems and neocortical systems, we see a lot of failures, but we'll also very often see failures in the older, phylogenetically older, deeper, more midline structures. So one of the interesting things that a lot of us are focusing on are these midline structures that have to do with vestibular integration and all of the deep things that basically we have in common with our nervous system that a lot of other things of lower sort of life forms or less cortical development would also have in their systems, because as we all know, the newer systems reference the older systems. And the reason for that really is that the older systems are really focused around understanding where we are and which way we're going and the basics of movement planning. So if that system goes awry, then it has knock-on consequences to all of the other systems, because all of the newer systems do, well, I'm speaking generally all of them, but newer systems rely on information from the older systems. So looking at this, particularly like vestibular integration and all of the things that we're seeing with the eye, with VOR and eye movements are really, really important. Saccades and pursuits are a really, really great window into what's happening in those older systems. So a lot of people ask me, where do you start with a patient? And that's really my answer. I always start with these older systems. So the more we can understand what it is that we're seeing when we look at that, the easier it is to translate that into a practical approach. Another way that I would often look at things, and this is just the way that I look at things, is I know that I want to try to create a long-term change in the system. So I look at the things that have longer-term effects. So that kind of comes down to understanding what systems have different effects. So I've broken this down in other videos before about the difference between tonic inputs and phasic inputs. So if you haven't seen that, dig into those videos. But tonic inputs are basically constantly giving information about which way gravity is coming from. Yes, there's arguments about it's giving translation, but all the translation is just a modification of the gravity vector. When you're going up and down, it's modifications of gravity. When you tilt yourself, it's a modification of gravity. All tonic receptors are giving a sense of load or the effects of gravity on our bodies. So the more we can understand how that system is working and whether that system, if we can evaluate the system which is perceiving that tonic input. In other words, these are joint proprioceptors and the load sensors in the muscles, like the Golgi tendon organ, also the Ruffini endings in the joint mechanoreceptors. Those are all tonically giving information to the brain. So if we were to see a problem in that system, because that's constantly giving information. That's going to have a different consequence to something which is phasic, something that's kind of the moment, which is telling us where we're moving, the accelerations and decelerations, or positive and negative acceleration that's happening in the moment to moment. That's really, really important for movement as well. But that's part of that whole feedback system. So it's giving us a sense of how the world is having an effect on us, or how our plans of moving in the world are actually resulting in movement. So that phasic system is super, super important. But again, that's a moment by moment thing. And interacting and using phasic inputs to create long-term changes would require a different kind of approach, where there's a high level of plasticity, a lot of level of training. So all kind of training is going to be working towards creating plasticity through those sort of phasic inputs, whereas things that are giving tonic inputs, I feel are, well, probably not just me, but I feel that those are giving a much greater consequence to long-term changes. So how can we affect tonic input when there's a problem with it? So problems with tonic input, and really what I'm talking about in this example, is the information that's coming in from those joints about where gravity is. If we have a subluxation, so there's been some sort of a trauma to the joint, which has resulted usually from a high velocity, high amplitude type of motion, is going to create a stretch and reflexive lengthening of that muscle. So it's going to reset the gain of the muscles. So in other words, what happens is a very high impact on a joint. So say you have a head trauma, or whiplash, whatever it is. If you have some sort of trauma, that's going to create a very, very high speed stretch. What that means is that the speed of that stretch was beyond the body's ability to create a contraction of muscles to preserve the integrity of that joint, so that the joint moved further than it should. So that's a high amplitude and faster than your body could manage. So that high velocity and high amplitude of movement can often create those traumas. So the resulting effect of that is that you're going to have some of the musculature around the joint, which is out of balance. So it's essentially too long or hypotonic, too loose, however you want to look at it. And then you're going to have a failure of those muscles to be able to contract sufficiently to give good stability, in which case you might have other muscles compensating to try to contract and create stability in the joint through more extrinsic muscles or different layers of muscles around there. But at the same time, you're also going to have the opposite muscle, which has been lengthened, tighter as well. So that's also going to compromise the joint. So one of the keys of trying to resolve that is essentially trying to find which muscles are too tight, the deepest muscles first. So those are going to be like intrinsic muscles. So if we can zero in on those deep muscles which are too tight as a result of this imbalance and stretch it in a very direct way, then we have a good probability through that fast stretch of stimulating the Golgi tendon organ. So basically that very, very high load but a low amplitude in a precise vector, which is very often opposite to the trauma, is going to elicit a response that will create a lengthening or a relaxation of that muscle, which in turn is going to stop the inhibition of the one which had been originally injured. So we can create some balance of those intrinsics, and then in turn, greater stability of the joint and greater motion control. So that is something that can make a difference, and this is the basis of chiropractic as we all know it. However, knowing how to do that in a way which is going to be as precise as possible, I think is a really, really key element in this. And if any of you have seen any of my adjusting videos or the talk about why translational adjustments are very powerful, is I feel that they're a very, very good way of precisely getting to those muscles which are too tight. A lot of us love adjusting the joints, and we adjust the neck, and if we get 7 cavitations, it's a home run. We love that. I'm not talking about that at all. I'm talking about a very precise assessment that would allow us to figure out exactly which muscle is too tight and to stretch that muscle and leave everything else around that joint alone, leave the other joints alone. That for me in my clinic and people that I have taught to use that is working extremely well to rehabilitate the joint very, very quickly. In doing so, not only are we getting better movement of the joint and better afferentation of the cortex and better stability and better coupled motion, but at the same time, things don't come back. We can actually really resolve it. So it's not that kind of situation where they come back the next week and the same thing is there. If the same thing is there, we're probably not fixing it. As much as we'd like to convince ourselves that we are fixing things and that it does take 20 sessions, I think that that's, wrong. I think it's wrong. Okay. I don't think it should take 20 sessions to fix anything. If we're not getting it quickly, then we're probably barking up the wrong tree. And yes, indeed, in some cases, we would want to use, some other type of treatment. I'm not saying this is absolutely the only way to start, but it is one of the typical things that I will look at, primarily because that proprioception is so important to that deep, old midline system. And when we look at when there's a failure of integration in that system, one of the biggest reasons is because of these errors that are coming from the joints. So if the joint isn't moving properly, its axis of rotation has changed so dramatically that it's giving a lot of error signals. In other words, the brain is telling it to do one thing, but because these muscles are out of balance, it might be telling it to pivot to the right, to rotate to the right. But because these muscles are so tight on the left, or I think this image is reversed actually. So if this is your right when you're looking at it, if we say that there's tension on the right, and we try to turn to the left and it's not moving, then it's probably because there's some muscles that are limiting that. So your brain is expecting this joint to be here and to be moving this way, but if it can't actually move and the axis of rotation is shifted towards that tension, then what's going to happen is it's going to move aberrantly and it's going to be sending signals about exactly where it is and what movement happened, but it's not what the brain was telling it to do. So that's going to create a lot of work for your brain to try to manage all of those errors, and then create some other compensations or other muscles to try to get the joints stable, to try to get the joints to move. And it's an ongoing compensation system. So by resolving your brain's ability to perceive where gravity is, by resolving that subluxation, the whole system can function much more efficiently. So I find personally, to answer that question of what do I do first, is first I assess that whole system, and I use a lot of VOR testing, a lot of eye movement testing, to gain some insight into that, and breaking things down with head movements and not eye movements and so on. But we can get into that later. But looking at this whole system very effectively is, and figuring out exactly what joints or what types of motion are breaking down the eye motion or breaking down the VOR, is a really, really great tool. So once we can resolve that, we know that we're getting good feedback from those proprioceptors. So if that system still isn't integrating well, then we can break it down into things that would be kind of the less likelies. But at least knowing that the integrative system is working well, we can probably improve joint mechanoreceptors. In other words, clearer function. We can reduce errors. We can get better movement in the joint, which is going to help all the pain and all that whole scenario. That's great, but we're neurologists. We want to see better brain function. So if we have less errors and that joint's moving well, and that whole system is integrating, that means we have better stability and we know where we are, and all the movement planning systems can function much better as well. So things that we may have thought were problems with cerebellar problems, they have these movement disorders, or not all movement disorders, but say they have some movement, they have trouble moving in one direction. It might be because their brain isn't perceiving that area of space because they can't get their head into that area of space or their eyes into that area of space. So if we can resolve that system first, it just clears up the whole rest of the diagnostic protocol. So I use a lot of treatment in my evaluations. So obviously clearing away a lot of red flags and things first, but at the same time, I want to get that assessment of those deeper level systems. And once I have that, and then I have that, I'll clear that as quickly as possible. And then I'll continue with other examination. is a great way to at least eliminate some of the most likely things that would be problems. So anyway, I hope that's helpful to you. There's a lot more we can go on in this, but anyway, I just wanted to answer the question of what do I treat first, and different perspectives on how to address things. So again, I'm not really looking at things from a perspective of it's basal ganglia or cerebellum straight away, straight out of the box. I want to check those deeper level, those midline integrative systems first. And once I see that that whole system is working well, or I've made that system work well, and it's consistently working well, then I look into the rest of the system. So I hope that's helpful. Thanks for watching. And if you have any comments or questions, just drop them in below, and I'll be happy to talk about whatever you guys are interested in. Thanks for watching.